Atlanta is held to a higher standard than many other popular cities that we know. Atlanta is home to not only the Centers for Disease Control and Prevention, or as we know as the CDC, but many hospitals and clinics such as Grady, Children's Healthcare of Atlanta, as we know it as Eccleston Hospital, Emory University Hospital, and many more. Pharmacies in Atlanta are accessible almost everywhere within the city and are found to be open 24/7. With these high standards, the citizens of Atlanta face many challenges and issues when it comes to healthcare. In my previous speeches, I've talked about my work with the public safety and the care that I have for it and its issues. It is necessary to educate people on these issues that many families and people struggle with when it comes to their health care. Today I'm going to discuss critical issues that Atlanta is struggling with within the health care that low-income and high-risk citizens get hit with the most. These issues include issues that low-income and high-risk citizens are struggling with, health care costs, and closing the hospitals and its effects. Starting off with some of the issues in healthcare today. Issues in healthcare in Atlanta range from many varied reasons. Some of the reasons that the citizens of Atlanta struggle with healthcare coverage is not being able to get healthcare due to high premium cost, delaying getting insurance due to cost, and people are struggling to pay their medical bills. High premium costs make it harder for the low-income or high-risk patients to have access to healthcare since they cannot either afford it or they cannot work to afford it. A survey was conducted from April 12, 2021 to May 3, 2021 on residents of Atlanta, and it found that 3 in 5, or 64%, reported that one of the three reasons or burdens when it comes to healthcare in Atlanta. When it comes to many residents of Atlanta delaying the process of getting healthcare, the same survey found that 34% delayed going to the doctor or having a procedure done. 33% skipped a recommended medical test or treatment. 31% skipped needing dental care. 29% avoided going to the doctor or having a procedure done altogether. And 27% had problems getting medical health care and or additional treatment. 22% cut their pills in half or skipped doses of medication. 22% also did not fill a prescription. These numbers go to show that the issues and costs for healthcare that these residents are experiencing are causing people to put their health on the back burner and not being able to go to the doctor and take care of themselves. With that, the people who decide to go to the doctor are now looking at medical bills that insurance didn't cover. Medical bills can affect credit just like a car loan can. Continuing with the same survey found on the Healthcare Value Hub, it stated nearly 44% of the Metro Atlanta region adults experienced one or more of these struggles to pay their medical bills. 18% borrowed money, got a loan, or another mortgage on their home. 17% were unable to pay for their basic necessities such as food, heat, or housing. 15% were contacted by a collection agency. 14% used up all or most of their savings to pay these bills. 11% racked up large amounts of credit card debt. And 10% placed on long-term payment plans. These issues put fear and worry into the community because it scares residents for the future because they are uncertain of what they're going to do when it comes to their health. Moving forward moving on more with the cost issues of healthcare. The cost in Atlanta is higher than the national average for healthcare. The low-income or higher-risk patients in Atlanta feel more impacted than anyone because they're already paying higher premiums than people around the country. When the cost of insurance for the public is increased and inflation rises in the country, this makes it to where people can no longer afford to go see a doctor. Medicare is available to those who cannot access private health care, but when Medicare fails to be accessible for everyone, then the lower income and higher risk patients fail to be able to take care of themselves. Fox 5 stated, according to the researchers, Georgia ranks third worst in healthcare costs and has the third highest rate of residents who lack health insurance. This is only proving that the Atlanta citizens are being failed by our state government daily. Fox 5 also said, the study found that more than 15% of Georgians have chosen not to see a doctor in the past year due to cost. Moving on with our last topic with the closing of Atlanta hospitals. Wellstar Atlanta Medical Hospital is a nonprofit hospital that gives access to citizens of Atlanta to healthcare without having to have private insurance, more or less like a charity. Sadly, November in 2022, this hospital closed its doors. According to GPB, they stated Wellstar blamed the closure on decreasing revenue and increasing cost, saying losses from operations at Atlanta Medical Center reached $107 million over 12 months. The closing of this hospital now not only puts strain on the residents who use this hospital on a weekly basis, but other hospitals in the area that will have an overflow of patients coming in the door that they cannot handle. GPB also stated in their article, Grady Memorial Hospital, just 1 mile south of AMC, is the largest hospital in the state with 953 beds. Once Atlanta Medical Center chooses or closes, Grady is expected to take on 200 extra patients a day. We now have patients who have been admitted having to spend several hours in the ER before they are even assigned an inpatient bed. And CEO of Grady Health Systems, John Hergert, speaking with GPB in late August, with the hospitals having an overflow of patients, they cannot access everyone. And with the people of Atlanta, even with Grady's help, could be left with the option of having to travel 100 miles south to make it just to receive medical attention if they cannot receive it in Atlanta. With some of the charity hospitals in Atlanta shutting down, it's leaving residents who rely on them with no answers and no hope. Now that we have gone over the many issues pertaining to healthcare in Atlanta, we will now move to part 2 of this speech. And Charisma will go over some of the solutions and issues to these issues with healthcare in Atlanta.